who is Charlin? What does Charlin mean? What does the name mean? What is this company all about? What do they do? How did it get started? All these questions that I get whenever I meet families and meet doctors and meet people in the community in DFW. This video is to explain the origin and who Charlin is, so you can understand our heart and what we do and how we do it, and so you can get a little bit of glimpse of who Charlin is. So let's go. All right, so the name Charlin Health Services, it's sounded like Charlotte. So when you think about Charlotte Hornets, Charlotte, North Carolina, it's Charlin. And my mom, our founder, started the company in 2003. And I remember my mom and my dad were trying to find the name. I was a kid, for the company, and my dad was like, well, why don't you do like ABC Home Health or 123 Home Health, because back in the day you had the phone book, right? The yellow pages. It's all about getting that name at the top. And for those of you who are young and don't know what a phone book or the yellow pages are, chat GPT it or Google it. That'll help you get a good picture. So my dad at that time was saying that it's a great company name, and also it's more of a sellable kind of company. And so my mom really didn't want to build a company to where she could sell it. Her goal was actually to pass it on to her two boys. And so back in the 90s, my mom was a nurse. She worked at Baylor, Columbia at the time, and she saw that private equity was actually, rolling in and buying out these healthcare organizations and mergers and acquisitions and such. And she wanted to be able to not start a company like that. She wanted to be able to make a difference in the community. And so hence her and a few people started Charlin with the goal of handing it on to a legacy, the company, and to her boys. And so she named Charlin a combination of me and my brother. So my name is Charles. I'm the administrator for Charlin. And then my brother, Kingsley Bryce, his nickname when we were kids was Eenie, I-N-I.
It's a rare condition this day and age to read any good news on the newspaper page. And love and tradition of the grand design.
We both went to St. Mark's Catholic School in Plano, then went to Jesuit. And so her goal was to hand over to us, but as a kid, I didn't really want to be a part of it, to be honest. I would just help out just to help out. Shred paperwork in middle school, and my mom would go and see patients throughout the whole Metroplex, everywhere. And I'm actually going to pan over to the original OG company car that was her first car, and that she went to go see so many patients throughout the whole Metroplex by herself. And everyone knew my mom as Miss Rosie, the nurse. And so I'm going to pan over to the company car. All right, so this is the classic OG Honda CR-V company car. There it is. Let me switch it so you guys can see it. Yep, good old Miss Rosie's car. Decided to wrap it a couple years ago just to honor her, but look at those roses in honor of her, the hard work, the blood, sweat, and tears that she put into the agency. Nobody really knows. And that's what happens with business ownership, is that you work hard, you do things that nobody sees in order to help other people. And honestly, that's what my mom did for so many years. So if you're out and about and you see our company cars throughout the Metroplex, there's a purpose behind it. There's something intentional. And so the reason why I wrapped my mom's car was just to honor her and to keep that legacy going, so that anyone who's out there in the company, they know that this dove means care. All right, so let's talk about our logo. That's our logo right there. So our logo is comprised of a dove and a cross. And so when you think about healthcare was started with the mission of serving others, thinking of other people as better than themselves with Christian values. And so for us, everything we do is centered on biblical truths. We don't push anyone towards it. We just exude it. And so when you look at the cross, it's about serving. It's about laying yourself down for others. And that dove is a symbol of the Holy Spirit, which is we can't do what we do in terms of helping other people without God's help, without God's strength. And so that's Charlin in a nutshell. When you look at that logo is a symbol of who we are and what we do and how we do it day in, day out with God's strength. And it's all about one patient, one family, one home at a time. All right, so let's go back. Let's go back to me not wanting to be a part of the company, basically. When I was a kid, I went to St. Louis, played soccer at St. Louis University, met my wife there, did physical therapy, worked at a regional hospital, and then in 2016, my mom called me back and said, hey, I can't do this anymore. I'm thinking about selling the company. And I was like, that's weird. You've never said you wanted to sell the company. Why do you want to do that? So I was at a crossroads. Asked the Lord, I said, Lord, do you want me to do this? Do you want me to move back from St. Louis? Me and my wife prayed about it, and we did. And so, learned underneath my mom for a while. It took me several years to understand the industry, the needs, and I asked God to give me a vision for the company, and the vision happened to be almost the exact same for what my mom started it, which was to provide a great service, family-owned, faith-based, privately owned in the Dallas-Fort Worth Metroplex, and a place where people, families, patients, employees can feel welcomed and feel part of the family. And so we're in this for the long run, legacies and years to come, to serve DFW with great care, mission driven, and it's corny, but our heart is to be the Chick-fil-A of healthcare at home. When you're thinking about good care, good service, come to Charlin. You can get good care. We're not perfect. We will make mistakes. I can guarantee you on that, but because we're all human and we're all flawed. But just know that our heart and the mission and what we do is to serve and to help people and to get an understanding of the need. And if we can solve it and we can help, then we will. So yeah, that's Charlin in a nutshell. So if you're watching this for the first time, this is who we are. Welcome to the family. If you're watching this in the community, just learning about who we are, if you're watching it as an employee or a potential patient, there's really nothing to hide here. We're here for you, and we're here to help and to carry the mission of what my mom started 20 plus years ago. So God bless, and see you on our channel. Like, subscribe, share, and we'll see you next time.